In this video, we'll be covering actinomyces israelii, the first of the two gram-positive branching rods. When you see the name actinomyces israelii, you may be naturally drawn to the more familiar word of the two, which would be Israelii. We're going to capitalize on that and make this scene about an Israeli soldier. So the title of this drawing is simply Israeli Soldier. So let's start drawing the scene, which will feature an Israeli soldier under a tree in the desert. So let's start with some identifiers first. The first thing you should know about actinomyces, I already mentioned, is that it's a gram-positive filamentous rod, or a branching rod. To remember this, we're going to draw a tree in the background with nice long branches. Secondly, you should know that actinomyces is an obligate anaerobe. This is important to remember because it distinguishes it from nocardia, which is an obligate aerobe. To help you remember this important piece of information, we're going to use our obligate anaerobe symbol that we've used so many times in previous videos, this gas mask. Let's put this gas mask next to our soldier. It goes really well with the whole soldier theme. Actinomyces is normal flora of the oral cavity, so an infection is often associated with jaw trauma. Actinomyces takes advantage of tissue injury, allowing it to spread along the head and neck. Since dental procedures can cause trauma in the jaw area, you may see recent dental work in a question stem. When the infection sets in, it begins to invade surrounding structures and is referred to as cervicofacial actinomyces infection. This is the main actinomyces infection you need to know for step 1. To help you remember that actinomyces infection is associated with jaw trauma, we're going to draw a jaw wrap around this soldier's jaw. We've also made it violet to help you remember that actinomyces is a gram-positive organism. Cervicofacial actinomyces has a fairly slow course and usually begins with a non-tender lump on the jaw. Eventually this will form an abscess, which is followed by the appearance of sinus tracts that drain the infection site through the skin. These sinus tracts drain a thick yellow pus from the infection, and this pus is yellow because it contains these characteristic yellow sulfur granules. You have to remember both draining sinus tracts and yellow sulfur granules because they're really great buzzwords that can give you the answer right away. To remember that actinomyces causes the formation of sinus tracts, we're going to draw a canal with a storm drain here on the right side. To remember that these sinus tracts drain that pus with characteristic yellow sulfur granules, we're going to take advantage of the desert scene because desert sand is yellow and granular, and really emphasize these yellow granular rocks around the soldier. So this will remind you of the sulfur granules. Let's talk about treatment. For the step 1, you should know that penicillin G can be used to treat actinomyces. For the more complicated cases, surgical drainage may also be warranted. So we'll draw our penicillin pencil in the soldier's hand to help you remember this.